Hello, everyone. Welcome to our broadcast. I'm your host, Matt Colmia. I am the Executive Director of Digital Strategy here at the Providence Digital Innovation Group. As a quick reminder before we get started, the information provided during this event is for informational purposes only. For any medical questions, please reach out to your primary care provider or healthcare professional. Maybe it's a Providence one, just saying. Now let's go ahead and get started. Today we are talking about the year ahead for digital in healthcare. And of course, for that, joining me during this live event is Sarah Vaizi. She's our Executive Vice President and Chief Strategy and Digital Officer. Welcome, Sarah. Excited for the chance to chat.
Thanks, Matt. Looking forward to it.
So it's hard to believe, but 2022 is coming to a close. Today, we're going to talk a ton about sort of the year ahead, what to expect in 2023, what digital strategy growth leaders should be thinking about. But before we do that, quick pause to reflect a bit on this past year. So it was a wild one. What in your mind was the headline for health systems in 2022?
The headline for health systems this year was unfortunately not a very good one. It was a year of tremendous challenge. We've been grappling with COVID since 2020, and 2020 and 2021, we thought that was kind of as hard as it's going to get, and 2022 was worse. And unfortunately, with sort of other macroeconomic things that have happened, war in Europe and Ukraine, with the invasion, the inflation, massive inflation, workforce issues kind of globally, not just in healthcare, although certainly really pronounced in healthcare. 2022 was just a really tough year for health systems. And it wasn't offset by, sort of positive performance, for instance, in the stock market, which is what was offsetting some things in the past. So a really tough year, really, I would say, stark manifestation of the challenges in terms of like where who's benefiting in healthcare.
Mm-hmm.
And who's benefiting in healthcare, unfortunately, is not the patient, because experiences are getting worse. Affordability is continuing to get more and more challenging. And it's not the providers either. We've got huge amounts of provider burnout. There was a report that came out in November from Definitive Healthcare that said that I think 334,000 clinicians left the workforce in 2021, and they continued to leave in 2022. Over 170,000 of those folks, I believe, were physicians. Tens of thousands of nurses and other, disciplines within healthcare as well. So, the benefit is not accruing in any way to patients or clinicians or providers, and it's accruing to places like insurance companies, which are continuing to make record profits. And I think that's been kind of the headline, is like the just real obviousness of how broken the system has become. We can't ignore it anymore. So I think health systems are saying, okay, well, what does that mean for us, right? It means that, one, we've really got to focus on our own sustainability and recovery, and frankly, performance. Health systems have always been really focused on quality and delivering really great care. But increasingly, it's now becoming obvious that value is a really important part of the equation. And, we're seeing systems double down on those types of things that are really core to what we're going to be in the future, which is like high value organizations that perform well. And that's been, our theme is recovery and renewal. 2022 was all about recovery and renewal. given all of the headwinds that we are facing.
And did anything, with all these headwinds, did anything surprise you about the way that health systems sort of writ large responded?
I wouldn't say it was surprising, but I actually don't think it's surprising at all, but it was a bit disheartening. And I say this with my digital hat on now. Many organizations actually shifted away from their digital and digital innovation efforts. And they, in many cases, they shut digital teams down, shut innovation teams down, really doubled down on like Epic only, for instance. And Epic is fine. It's a really solid technology for certain things, but it's not, for instance, a consumer-facing platform. And in the modern sense. And so, swinging really far in the other direction after several years of progress around how you do digital transformation, that was something that we have seen has been a very clear trend. And it's not surprising because that often happens, right? Like the benefits a lot of innovation often lag the investment that you have to put in. And as a result of that, and digital health, for instance, has really struggled with that. We don't have as much to show for the billions of dollars that collectively across the industry has been invested in digital within healthcare as we should. We don't have enough to show for it, right? And so that's manifesting itself in this swing completely back in the opposite direction, which is to say, we're just going to abandon these efforts, or at least for the time being. They're very much nice to have. And I would say, yeah, to some extent they are nice to have if you don't have any value to demonstrate for it, or it's if you're just dabbling. But in many cases, it's not a nice to have. And it really is essential in terms of how you present an experience to a user that is personalized and meaningful to them and actually helps them get the information that they need or complete the task that they're trying to complete. So, so not surprising. These kinds of things always happen, but a bit disheartening that that's kind of where we ended up.
Yeah, and I think a lot of these organizations are going to find themselves refocusing, not just because of their fewer resources, but questioning for themselves the way you just mentioned that what does digital really need to do for us to make it worth the investment. It can't be a hobby. It can't be a cool, exciting toy that we have on the side, but it really has to be fundamental to our core for it to make it worth that investment. Yep. So with that, let's turn a little bit into sort of the forward-looking 2023. What lies ahead for digital health? If a lot of these organizations are now going to start taking hard looks and refocusing, or even building somewhat from scratch, give us some themes to think about. Where should people point their interest?
So I can say from our perspective, where we've focused and where we've continued to get even crisper around the thesis of the work and what we're trying to do from a digital transformation standpoint, it's frankly a playbook that's been used in a lot of other industries. And that playbook is, when travel, for instance, went through its big digital transformation, when transportation within a city went through its big digital transformation, they focus fundamentally on a couple different things. Using technology to transform the way that demand is generated, aggregated, and captured. And it's for the purposes of driving growth through differentiated experiences and that kind of thing. And that's where we're focused. There's all sorts of things that you can do from a digital standpoint. You can focus on chronic disease management. You can do RPM. You can do infrastructure modernization. You can do all sorts of things. And when it comes to sort of the customer-facing side of things, that's where we've chosen to focus, is on that sort of vanguard of transformation that has had meaningful impact in other industries. So that's what we're doing. And it's, I would say there's kind of a couple of pretty important takeaways when it comes to that. Digital shouldn't just be sort of this thin veneer, maybe even a transactional veneer, or just it's not sufficient just to say, hey, I can book my appointment online. That's not true digital transformation. That's or, I can now do a virtual visit with my provider instead of a physical visit. Those things are okay, but they're substitutive. They're not truly capturing the value of digital, which is much more like an operational transformation, as much as it is a technological one. So that's one area where it's like deep operational transformation driven by the ability to leverage digital for, demand generation and demand capture. The other one is, I think we have been talking about identity driven personalization a lot at Providence. And the reason for that is, we've got the Providence Promise, and the Providence Promise is know me, care for me, ease my way. You have to know people. That's step one. And you got to, in order to, when you want to care for them and ease their way in a personalized way that's actually relevant and ongoing and not just based on like sort of spot clinical encounters, but a much more whole person approach, that's where identity-driven engagement comes in. So know me as an individual based on the data sources, and then serve up experiences that actually are meaningful, right? And rooted in that data. And it's N of one personalization. It's not like based on high-level personas or things like that. Those are still like customization or segmentation. That's fine too, but it's not true personalization. And so I think that's another big one. And then the third thing I would say is sort of platforming or platformization of healthcare. We've been kind of talking about that for a while, and it's been this like vague concept, but I think we're finally getting there around specific use cases like identity-driven engagement. I don't know if it makes sense to say platformizing all of healthcare. I mean, like, what are we really trying to get there? But if we're talking about a consumer experience that is akin to a consumer experience in another industry where you're, let's just use Amazon as the example, right? Your homepage looks different from my homepage. It helps us buy things that are relevant to us and serve our needs as individuals and consumers. Similarly, identity-driven engagement can be the basis for at least some platformization that's occurring in healthcare. And then the last thing I would say is not really so much a technological thing, but it's more of a, going back to the value point, the ability to track the value of how these things support patients in getting better, kind of driving toward better outcomes, getting sort of a more holistic health experience, as opposed to just, again, like sort of spot episodic types of things that are much more focused, I would say, on like picking up the pieces as opposed to a health related sort of view. And it doesn't provide a great clinician experience because, again, it's so downstream as opposed to more upstream. Demonstrating value around that, and then also demonstrating economic value for buyers of digital platforms, right? Like, healthcare is fundamentally a B2B2C business. It's not as much a direct to consumer business. It is to some extent in certain services, but it's a B2B2C business. And that second B, there has to be something in it for them too, right? Yeah. And that's where we get to like that overall economic case. And to the very first kind of question you asked me about, like, what's the headline for health systems, which is like, things are rough right now, right? And there's got to be some demonstrable value for those platforms that we're putting in place for the health system. And so I think those are going to be some of the big themes that we see in 2023.
One thread I noticed in there, a lot of this is about taking sort of the disparate individual points and stringing them together to kind of create experiences. And I want to go back to your first point, because I really like that one, about digital as a growth strategy and not just some sort of transactional veneer. Can you talk a little bit about what it means to be, what do you mean by transaction focused versus, say, engagement focused?
Yeah. So transaction focused, like, we could actually take like a transaction, right? I'm trying to book a visit, or I'm trying to pay my bill or something like that, right? Like, those things are, the temporal element associated with it is very short. It's very limited in terms of its scope around knowing me as an individual and what my needs are. And it sort of emerges and then fades away just around a very narrow sort of experience. It's fine, but what happens in those scenarios is that essentially, like, there's no habit created. There's no ongoing relationship created. People are, you don't build loyalty that way. You just have like this very, very episodic kind of interaction. But where true value is created is through loyalty, and loyalty not through entrapping someone, but through engaging them. And what we mean by that is, like, think about not just one clinical encounter, but think about what is the next best thing that I should be doing. And maybe it is another clinical encounter. Maybe it's a piece of content. Maybe it's an additional product or service. It's in the interstitial spaces between individual clinical encounters. That's the engagement mindset. It's much more of like a life cycle mindset. And it comes down to seeing people as whole people and all of the data sources that make up what is relevant to that whole person versus just one clinical encounter that lives within an electronic medical record, which doesn't really know you. And by the way, was fundamentally made as a coding and billing platform. So that's what we mean, right? It's the temporality, it's the relationship that's built on that. It's the visibility into what matters within that relationship, how behavior actually connects within that relationship, right? So for instance, in many cases, there are platforms out there where we don't know like what's useful within this platform based on consumer behavior. What parts of a platform are they engaging with and what parts are they not engaging with, right? It becomes a black box. And it's important to know those things because you want to know what has utility. And so that's the engagement mindset, is knowing what matters to the user, knowing what parts they want to engage with, because you've instrumented a platform in such a way that you have visibility into that. And it's much more, again, it's like there's a data element, there's a defragmentation of the experience element, there's a time component to it, so that you really are engaging over in those interstitial spaces and a whole lot of other things.
Do you have any favorite examples of where healthcare does an especially bad job of engaging patients? Like, what are some missed opportunities where we just kind of consistently drop the ball around being so like transactional, like come in and then, leave off into the wild blue yonder?
Well, I want to give credit where credit's due and say that I think there are actually a lot of pockets of greatness. The challenge is that those pockets of greatness are done manually and in a really clunky way that can actually be very difficult for caregivers, right? And so one example of that, for instance, is gap closure. So, I am due for some sort of preventive care, and like that entire process of like my primary care provider reaching out to me, ensuring that I know where I'm supposed to be going, actually getting the preventive care booked, and then ensuring that there's loop closure around did that happen, and if there was additional care that was needed, that whole cycle, that's done manually and in a very it's all done manually, very clunky. It's, in order to get people in, for instance, to a referral, it's really hard, right? Like after these types of processes, like 7 calls, right? And it's not that it's folks don't want to do it or they don't have the best intentions. It's that the systems and the technology aren't there to support that. And the processes are broken as well. And so those are like the types of examples that I can think of that are well-meaning, but just challenged, right? And they become very expensive for the system. They become very, very not friendly for the patient or the consumer. Another example of that is we actually force users to they're like on their own, right? Our patients are on their own. And in many cases, because we've asked them to just be on their own, they default to now sending my chart messages to their providers. And we've seen a
Mm-hmm.
huge explosion, like orders of magnitude greater in-basket messages for clinicians than we had seen prior to COVID. And the reason is that we've trained people to use digital means to communicate with their care teams because they couldn't come in physically to a visit, to an office or whatever. And there were all these changes on the supply side of things. And so that puts a burden on the provider, and it drags out the amount of time that folks can get an answer because just the volume is too high, right? So I think, I like to give credit to health systems and to providers, primarily because I think it's kind of like they get a lot of like flack, right? We kind of, everyone, especially in the innovation communities, kind of hate on us a lot because our systems are difficult to navigate, but we're doing it at scale, but in a really tough, clumsy way. And so those are the types of things that I think have tremendous potential to be transformed.
And especially when burnout's as high as it is, when we have the workforce shortages we do, trying to rely on heavy manual processes for a lot of these things is just not going to be sustainable, even if we are doing them today.
That's right. That's exactly right.
So I want to turn back to another sort of theme you mentioned around digital as growth. So when most executives think about growth and customer acquisition, marketing is their sort of first stop, and all the credit in the world to the amazing marketing folks at Providence who've just done a phenomenal job. But we talked a little bit, and I've heard you talk in other settings about digital health playing a big role in growth as well. Can you talk about that? Can you talk about digital in healthcare as a growth strategy?
Yeah. And, when we talk about it, we think about it in the context of 3 levers that we are trying to pull. And marketing is a big part of that, actually. In our organization, marketing, digital experience, and product innovation and incubation all work very closely together to pull these 3 levers. The first is around new customer acquisition in sort of unique modern ways through propensity-driven, data-driven marketing, for instance. We're actually very efficient in our system, and healthcare just kind of has to be because of the margin structure, very efficient in terms of the dollars that we spend. And we're able to track those dollars on marketing to understand how we're acquiring patients or how we're retaining them. And so new customer acquisition is a big one. Scaling patient retention and doing so in, again, a sort of scalable way, I think is the second big lever that we're pulling. So if we're bringing in a lot of new customers, but then losing most of them to other providers, whether there are providers, like kind of traditional incumbent providers or non-traditional or pay-biders or what have you, it's not good, right? So scaling patient retention and doing that through things like identity-driven engagement. And then there's also an economic lever to growth, which is LTV. In some cases, folks call it lifetime value. In some cases, folks call it long-term value. We think about it in terms of long-term value. And it's, when you surface up relevant products and services to folks, whether they're clinical or otherwise, that it helps to support keeping spend in your broader network, and that has a growth value prop as well. So those are the 3 levers that we're trying to pull via digital, and it really ultimately gets back to that generate, aggregate, and capture demand differently kind of approach that I talked about at the very beginning.
Now let's pivot to another topic you brought up here, personalization. So I know that Providence is doing a lot of work around knowing our customers, according to our promise, and even working on some sort of platform solutions that power personalized engagement. How does that happen? Like, what tools does a health system need to power that next level of consumer engagement where you actually know somebody?
We're doing this. This is one of the most important things that we're doing. And we're doing this in a couple different places. I referenced our marketing team and the data-driven marketing that they're doing. One of the areas that's relevant in this context is something that team has built called our customer data platform. And that customer data platform takes different sources of data, including clinical data, financial data, web data, and puts it into a profile of an individual that is used to drive outbound marketing that's relevant to an individual. So we can basically say we know when someone is in need of a specific service based on their activities and the different data sources that we have about them. And we're able, as a result, to reach out to them and get them into the network for those services. So this is not about like selling shoes or books or whatever. We're not just trying to sell for the sake of selling. We're trying to get the right service in the hands of the people who need them based on what we know about their activities with us. So that CDP, or customer data platform, is one really great example of that. And the work that we've done there has generated what we call ROMI, return on marketing investment, of 8 to 1, meaning for every dollar that we spend, we generate $8 of revenue. And so it's a win-win. It helps with the economic sustainability of the system, but it ultimately gets the patient into the service that they need, the right service, and we kind of cultivate that relationship. The other area where personalization is actually live and being used within our system is around our customer identity and engagement platform, and that's a lot of the identity-driven engagement platform work that I mentioned earlier. So we have built something that's in 4 components, essentially. The first is an identity and profile service. So it doesn't matter if you are already a patient of ours, but you can create an account, a digital account with us. That digital account can be linked to a patient account. If you have one, there can be synchronization and resolution across different instances of accounts. And it can be federated to partners, meaning it can be connected to third parties that may be outside of the Providence ecosystem. And there is also profile data around that's much more rich about who you are and the information, essentially, that then drives personalized experiences. That's the second component, is experience. And it surfaces up in our in authenticated or logged in states on our digital properties, our website, our mobile app. And the things that show up there are, again, like, what shows up for me is what's relevant to Sarah. What shows up for you is what's relevant to Matt. And it's what shows up there is not just Providence stuff, products and services. It's actually connected to the third thing, which is an ecosystem of products and services that are provided by Providence, but also others like Omada, or which is a diabetes prevention program that is digitally enabled, or services like digital computerized cognitive behavioral therapy, those types of things. Again, because it's been personally recommended to an individual from their provider through a platform, for instance, like Xealth, which is a digital prescription platform. So it really connects all the pieces and eliminates the fragmentation. It also connects to their medical records. So there's a direct connection into, in our case, my chart. And all my clinical information is also in that same place. So it's a single unified access channel that leverages my identity and my clinical record, as well as all the other products and services that are relevant to me. And then the last thing is, to the value point that we talked about, is we can actually tell what folks are engaging with. We've instrumented the platform in such a way that we can say, 80% of our users also use MyChart. They go into the MyChart SDK. 75% of folks are booking appointments via this platform, et cetera, et cetera. And what does that actually mean in terms of, like, from a quantitative perspective? We can say that. So those are the two big areas, the CDP and then the CIEP, the Customer Identity and Engagement Platform. Those are two big efforts that drive personalization and essentially put the right content and tools in the hands of users to be able to manage their own health.
It feels like a few years ago there was a big evolution between as more digital health tools and those things proliferated, we went from sort of silence to too much noise around these things, because you'd open your app, you'd open your provider website, and they just list everything under the sun.
Yep.
And it made healthcare, which is already really hard to navigate, even harder within your digital ecosystems. But what you're saying is that with this kind of personalization, you can clear out some of that noise to send the handful of messages that are actually going to be relevant to somebody when it's going to be relevant to them. So I'm not on my own navigating care, sort of swimming in oceans of websites, but I can find my way to the things organically, at least in my experience of them, to then go get the care that I need.
That's absolutely right. It's, like the proliferation of solutions is has been a trend. It's probably going to slow down next year, given the tough times that a lot of folks are going to be going through. But it's not going to stop over the fullness of time, right? Like that's kind of the nature of innovation, is more solutions being out there available to meet the needs of the meet demand, essentially, right? Meet the needs of patients and users. Now, you just talked about digital proliferation. I would argue that that's true in a physical state as well, right? Like increasingly, the environment of healthcare is disaggregated, decentralized, and you may get some of your care in one place and then some of your other care in another place. Like there's a lot of, for instance, provider-owned ambulatory surgery centers, or there are clinics that payers are building, and so like all these worlds are converging. And what that means is this like care options are not going to be wholly owned by your one provider. It's going to be a disaggregated environment, and it's really important to be able to make sense of that. Right. Yeah. Like that's like absolutely essential, and not having to go and figure it, like not forcing people to go figure it out on their own. So they're like the data elements, the experience elements, all of those things need to be lined up to support a much more like sensible and, experience that people can actually deal with, as opposed to like the morass that exists today and will get worse.
Absolutely. I see that we're over on time. They're going to play me off the stage here in just a sec. But before we go, at the beginning, I asked you about a headline for 2022. Bad in all capital letters. What about a headline for 2023? What would that be?
The headline for 2023 is, we're working through the challenges of 2022 with a much with a lot of sort of foundational technology, systems, infrastructure, and learnings, frankly, from the last 3 years that I am very, very hopeful are going to be the start of like a major inflection point for our system, as well as for healthcare in general. So I think 2023 is a year of, sort of transformation, and a lot of exciting things that are going to happen in the innovation community and the digital community, and then a lot of big changes that health systems are going to make to kind of respond to that.
Absolutely. Doing the hard work.
Yep.
All right. Thank you so much for joining today, Sarah, and thanks for everyone listening. To learn more about any of our initiatives, programs, services, ways to give, and of course, if you're looking for medical care, please visit providence.org. Thank you all for joining us today.